Welcome and thank you for joining us. I'm Gina Meusel from INCLUDEnyc, and this is one of a series of live stream presentations that we air monthly during the school year. We will keep it under 60 minutes, and we will use the chat box. So if you have questions, please feel free to chat us. We will do our best to answer them. You should all have received a digital handout packet containing information that we may refer to, as well as information about our guests. Today's topic is dyslexia, and we are coming to you from the Fordham School of Law Family Clinic. Joining us is Andrew Weisfeld, attorney at law, and current students. Thank you so much. Please introduce yourselves.
Hi, my name is Gina Meusel. I'm a social work intern at Fordham University's Family Advocacy Clinic.
Hi, my name is Rachel Liebert. I'm a legal intern at the Family Advocacy Clinic here at Lincoln Square Legal Services.
Hi, my name is Ryan Evans, and I'm also a legal intern in the clinic. I'll be moderating today's panel, and we just felt it important to start out with a note that a lot of these requirements and rules that we're going to talk about today vary from state to state. However, since a lot of you are tuning in from New York, we're going to try to focus on the New York rules and regulations. Here with us today, we have a special guest. His name is Andrew Weisfeld, and he's a special education attorney at the Cuddy Law Firm. He's also an alumni of the Fordham University School of Law and of the Family Advocacy Clinic. So thank you for taking the time to join our discussion.
Thank you, Ryan.
All right, so now we're going to get started. Gina, could you tell us what the definition of dyslexia is?
Hi, sure. Dyslexia is a term used to refer to learning difficulties characterized by poor spelling abilities and problems with interpreting words and reading.
So what are some of the symptoms that a parent might notice that could indicate that their child has dyslexia?
Well, difficulties may be associated with dyslexia if they're unusual for a child's developmental age or educational level or their age. They may have unusually or early late developmental stages such as talking, crawling, walking, or tying their shoes. For example, a preschooler, they may have problems with beginning to talk to other students and difficulty pronouncing words, such as they may say biscotti instead of spaghetti, and they have difficulty following multi-step routines. Most children with dyslexia appear to have a lot of the same traits. They appear to be intelligent and expressive, but they have problems ability to read, same as their peers. They're easily frustrated and get emotional when they're reading and writing. They spell phonetically how it sounds and very inconsistently. They're confused by letters, numbers, words, and verbal explanations such as stories. Their math shows dependence on counting on their fingers. They may know the answers, but they can't do it on paper. And they have trouble with writing and copying. Their pencil grip may be unusual. These mistakes and symptoms, they may increase dramatically with confusion, time pressure, emotional stress, or poor health.
Okay, so those are some of the signs that the parents can look out for. But for those watching who don't know, maybe you can explain what an IEP is.
An IEP, that stands for Individualized Education Plan. It's a legal document that spells out a child's learning needs, the services that the school will provide to aid in those needs, and how progress will be measured. A federal law called the Individuals with Disabilities Education Act, we know it as IDEA, it requires that public schools give each child that is receiving special education services, they receive an IEP.
Thanks, Gina. Rachel, maybe you could tell us what a parent should do if they suspect their child may have dyslexia in order to get this IEP.
Absolutely. So first I'd like to note that we're doing this presentation from New York City, so everything that we're talking about today is tailored to New York, but you should know that some things vary a little bit from state to state, so if you're outside, you should just check to make sure that the details that you have are correct. If a parent thinks that their child may have dyslexia, they can request an initial evaluation. So the parent can either write that request themselves or have the Department of Education help them to write it. Then that written request should be sent to the local Committee on Special Education, which is also known as a CSE. That written request should be sent either by email, fax, or hand delivery. And after the school receives it, if the student isn't already receiving general education interventions, the school should have a meeting with the parent to discuss whether or not those might be appropriate. That meeting should take place at a time that's convenient for both the school and the parent, and within 10 days of the school first receiving the request for evaluation. The school also has to consider whether response to intervention, which is also known as RTI, or remedial instruction is appropriate. But the time the school spends considering those things can't interfere with the special education evaluation or consideration process. Next, the parent will receive a notice of social history meeting, and that notice will basically ask the parent to come in to get some background information about the student. And that meeting can be held over the phone. The meeting should be no more than 15 days after the school receives the request for initial evaluation, but it has to give the parent at least 7 business days after the letter is sent to have the meeting so the parent can make time to come in. The parent can agree to have the meeting sooner than that if they want to, but the school can't require them to have it sooner than that. At the social history meeting, the parent will be asked to sign a consent for initial evaluation. After that's signed, the evaluation process will begin. Then the IEP meeting has to take place within 60 calendar days of the parent signing that consent for initial evaluation, unless the CSE and the parent agree to do it later.
Thanks, Rachel. Andrew, can you just tell everyone out there what an evaluation should look like?
Sure. So as Rachel was talking about, the district will conduct its initial evaluation. The district will normally conduct a social history, and as Rachel was mentioning, social history will be basically an interview with the parent to garner background information. The district will also likely do a classroom observation and a psychoeducational evaluation. A psychoeducational evaluation usually entails some cognitive testing like IQ testing. Sometimes it has some achievement testing in there, but the district often will stop there, especially with the student with dyslexia. But the district's evaluation needs to be comprehensive. It needs to cover all areas. So if there's an area of suspected need, such as speech and language, expressive abilities, receptive abilities, the district needs to do a speech and language evaluation. Maybe a student with dyslexia could be helped by some assistive technology, some kind of technology that will allow the student to read better or write better or communicate better. So maybe an assistive technology evaluation would be appropriate. Maybe, as Gina was talking about, the students exhibiting fine motor or sensory difficulties. So maybe an occupational therapy evaluation would be appropriate. Students with dyslexia who've been suffering for a long time in a classroom where they can't read or write and they're watching their peers be able to do it are going to get very, very frustrated in that classroom environment and oftentimes exhibit behaviors. The functional behavioral assessment would also be an appropriate evaluation if students manifesting some kind of behavioral concerns. So the district often doesn't do this comprehensive set of evaluations, but often that comprehensive set of evaluations is necessary. Next, the evaluations the district does often don't contain any type of recommendations for the student. The recommendations you'll see at the bottom usually involve the CSE, which means Committee of Special Education, will make the final determination regarding the student's recommendations. Now that's problematic if you have, for example, a speech and language evaluation without any recommendations for what the speech and language services should actually look like. The speech and language provider might not be at the IEP meeting, so how do we know what this evaluator is recommending? A good evaluation is always going to have recommendations. A good evaluation is also going to have goals in it for the student's upcoming school year. Oftentimes you'll see a district evaluation and will absolutely not have goals. The district's evaluation also needs to cover really all areas. So if you see a speech and language evaluation, for example, stick with that example, that's half a page in length, it's not going to cover everything that, it's not going to cover some expressive language testing, receptive language testing, pragmatic language testing. Pragmatic language is social language that needs to be covered in that evaluation. And we have to have test scores that are able to be interpreted by the parent. So if you receive an evaluation that says, for example, on that speech and language evaluation, receptive language on a standardized test the student received a score of 52. Now, what does that 52 mean? I don't know, the parent doesn't know, nobody knows. The evaluation has to have an explanation of that, percentile rankings, age equivalencies, so that the parent can understand. If the parent's not a native English speaker, the evaluation needs to be translated into that parent's native language in order for that parent to understand the evaluation. So those are some examples of what an evaluation should have in it.
Thank you for that. Gina, can you just tell us quickly how dyslexia is diagnosed and if the DOE evaluation will most likely be sufficient to diagnose dyslexia?
Sure, of course. A DOE evaluation will not be sufficient to diagnose dyslexia. However, it will be enough to determine special education eligibility and to choose a disability classification for an IEP. A child with dyslexia will probably be classified with special learning disability based on DOE evaluation. In most cases, testing for a diagnosis of dyslexia is from a clinical psychologist or a neuropsychologist. It's important to keep in mind that dyslexia is not a disease or an identifiable physical condition. It's a learning style that is determined by assessing a typical pattern of strengths and weaknesses. Other assessments that are used to rule out other possible causes of symptoms such as vision or hearing problems. The doctors must have high credentials that the school would see them as acceptable to the school. Considering the difficulty that it takes to find a credible evaluator, the DOE may not have a qualified professional in the school to get a diagnosis. School professionals may not diagnose dyslexia. Any screening done in the school usually is not a substitute for formal diagnostic services, and a formal diagnosis helps ensure that a child is qualified for services or accommodations.
And we should make it clear that a diagnosis of dyslexia is not the same as the classification that a child receives on their IEP. So a child who does have dyslexia will likely have an IEP that says they have a classification of learning disability or some other kind of classification that's determined by the IDEA. Sometimes educational agencies and IEP teams will refuse to use the word dyslexia on an IEP or related document. And parents and advocates should know that, in fact, they can use the word dyslexia, even though it's not a classification, in other parts of the document. And if you'd like to refer back, in October 2015, the Department of Education issued a Dear Colleague letter that said that the IDEA doesn't prohibit using the terms dyslexia, dyscalculia, or dysgraphia in evaluations, eligibility determinations, or IEP documents. So you can refer to that if you're having trouble with your team.
I'd like to just jump in because what Rachel said was very important there about districts attempting to not put things in IEPs that need to be in IEPs and saying they can't do it for some reason. Districts will often say that, well, we can't put it in there, we're not allowed to put it in there, it's not in our drop-down menu to put it in there. Whatever needs to allow for meaningful progress and whatever needs to be in an IEP to describe a student's needs and abilities needs to go in that IEP. So if in order to describe a student, if that student needs to be described as a student with dyslexia, that word needs to appear in the student's IEP. If you have a neuropsychological evaluation that says this is a student with dyslexia, it needs to appear in the IEP and it needs to be described. Parents often go to IEP meetings and are told by districts that the CSE cannot do something. Parents have to remember that the CSE absolutely can do whatever's necessary to allow for meaningful progress, and they have to.
And for our purposes, when we say IEP team and CSE, we really mean the same thing, the group of people who are making decisions about the IEP.
Okay, great. Moving on from the evaluation standpoint then, Rachel, if you could tell us what kind of notice is required that the parents will get for the IEP meeting.
Sure. So whenever the school either proposes or rejects someone else's proposal to change a student's identification, classification, or placement, the parent has to receive prior written notice of recommendation.
Okay, and who will be attending this IEP meeting?
So the parent is always required to be invited to the IEP meeting, and it's best for a school social worker to attend if possible, but they're not actually required. A parent can also request that a physician and another parent member attend, but in order for those people to be required to attend, the parent has to give at least 72 hours notice of their request before the IEP meeting happens. The district representative must be there, and there also has to be a school psychologist and a special education teacher at the meeting. If the student is going to be placed in a general education setting, or if they may be placed in a general education setting because that's being considered, then a general education teacher must be there as well. And there are some instances where a related service provider has to attend, but that's not the case in every situation.
Great. And what should the parents bring to this IEP meeting?
So if the child already has an IEP, the parent should bring that IEP. They should also bring the initial request or referral for evaluation. They should bring all prior written notices that they have and any notes that they may have from former meetings with the school, any report cards and progress reports, samples of the child's schoolwork and standardized test scores, disciplinary notices that the child may have received, and a behavior intervention plan if the child has one.
Okay, great. Andrew, could you maybe just tell us what the IEP meeting will be like?
Sure. Parent has to be prepared going into an IEP meeting that there's going to be several staff members and the parent. Now, there can be seen IEP meetings with 10, 11, 12 staff members and the parent. This can be problematic for a parent who has their child's best interest at heart, but meanwhile, the district may have some kind of different motivation for placing things on IEPs that they may have. So a parent needs to be ready for that. Something that it's really a mismatch between the amount of district staff members and the parent. And if a parent has a concern and you have 11 staff members saying, no, that's not a concern, that's going to be difficult for a parent to stick to the guns. Well, what I would recommend going into an IEP meeting for that reason would be for the parent to find an advocate to help them out. The Council of Parents, Attorneys, and Advocates, that's COPA, C-O-P-A-A. They have a website where you can find attorneys, where you can find advocates who can help you out. And it's very important to go into that meeting, A, prepared like Rachel was talking about before, but B, also have somebody on your side if that's possible. Now, at the meeting, the parent is part of the Committee of Special Education, and the parent, by law, has to be able to meaningfully participate in that meeting. If the parent cannot understand English, for example, and there's no translator present, that's a problem. How's the parent going to participate in that meeting meaningfully? In addition, if the parent cannot understand evaluations or understand what's going on with the student, the parent is not going to be able to meaningfully participate. All of that has to be explained to the parent so that the parent can be part of that CSE and be able to meaningfully participate. And the concerns that the parent expresses at the meeting have to be considered by the Committee of Special Education.
Thank you. Maybe you can discuss a little bit as to what will be discussed at this IEP meeting, what we should expect to see on the IEP, things of that nature.
Sure. So first off, a lot of district CSE meetings or IEP team meetings, as we said, they're synonymous. They last about 20 minutes and the parent is rushed out of there. These meetings have to cover a tremendous amount of material, and they have to plan for the students next year because the CSE doesn't have to reconvene more than annually. So this meeting should take a long time. This meeting should cover a lot of ground. It should be, I would think, at least an hour and a half at minimum. I mean, the IEP meetings that I've gone to, we've gone through everything. They've taken over 2 hours. So if CSE is trying to rush you out of there, that's problematic, and that's not an IEP meeting. You can't develop an IEP in that time. Now, before I get into the discussion, I want to talk about independent evaluations first, because the evaluations are really your firepower when you enter these IEP meetings. And if you have good evaluations, you have a really strong position by which to develop your child's educational program. So an independent educational evaluation can be requested by a parent if the parent disagrees with the evaluation the district conducted. So it's the parent's right to request that independent evaluation in any area of suspected need. So for a student with dyslexia, a parent would certainly want to request a neuropsychological evaluation to understand the student's diagnoses, to understand the student's educational needs, certainly a reading assessment. I would also imagine a speech and language evaluation to understand speech and language abilities. We talked about assistive technology before, assistive technology evaluation. Also, we talked about occupational therapy evaluation, that as well. Functional behavioral assessment, even if there are behaviors going on. Anything that's a suspected area of need. You don't have to know that it's an area of need, as the district may assert. It's just an area that's suspected. So, so when you're requesting this independent evaluation, it should be a comprehensive set of evaluations. Now again, if you're going to do this, language is important in your request, timelines are important. I would also strongly suggest representation to assist you with that. Now, if you have independent evaluations or you have district evaluations, all of that evaluative data needs to go into the IEP, and it needs to be discussed at the IEP meeting. Oftentimes I see IEPs where tests just aren't included in the IEPs, and I'm saying, where's that testing? It was done. The reader of the IEP from the present levels of performance, which is the initial section, has to be provided with a baseline of the child's needs and a baseline to measure progress. So all that testing data, all that evaluative data, everything we see in the independent evaluations or the district's evaluations, they really need to appear in the IEP. And the data needs to be current. What good is 2014 data for a 2000 when it's 2018? Districts are required to evaluate at least every 3 years, but still, evaluative data, even if it's 2015 and we're in that 3 years, that's not going to be helpful. So we have to have a firm understanding of what the child's needs are from those present levels of performance. Those present levels of performance should include reading ability, writing ability, math ability, behavior abilities, any kind of strengths, any kind of weaknesses, any kind of needs in terms of learning, really anything else that gives us a description and a baseline of the student. Now, for example, in reading, a district could put, over the past year, the child's reading abilities have improved. Now that doesn't help us at all because we don't know where the child is, we don't know how much it improved. If for example, the IEP says, 3 months ago the student could read 5 second grade sight words, and now the student is able to read 10 second grade level sight words independently, but cannot read more than 10 second grade sight words independently. That helps us. That we know where that child is. So that's what the levels of performance should look like. Classification should also be discussed. Most likely, this is a student with dyslexia. There's going to be a learning disability discussion, but you never know what the CSE might classify the student as. So you have to have a discussion about it. There also might be an accompanying impairment with the dyslexia. For example, a speech and language impairment with the dyslexia. So all of that there needs to be a discussion about classification at the CSE meeting. Okay, one moment. Oh yeah, and just going back to test scores, what I see a lot is that there will be reporting of a test score. For example, the SANDI assessment, SANDI. It'll say student received a score on the SANDI assessment of 52. Now that doesn't mean anything to me, and that won't mean anything to the parent. We need to have a breakdown of what everything means in those present levels of performance so that the parent can understand it and the reader of the IEP, probably going to be the teacher or anybody else, can understand exactly where the child is and what the child needs. Okay. Then we get into a section of the IEP of special factors related to students' needs. Now, in that section, there's if you've reviewed an IEP, you'll see some check boxes. It has to do with behavioral supports and strategies. If the student needs those, the student needs a behavior intervention plan. If the student needs assistive technology, the student needs assistive technology in the home environment. Oftentimes, this is not discussed at a CSE meeting. Oftentimes, the district simply checks no for all of these. Especially with a student with dyslexia, the CSE might simply focus on, oh, dyslexia, we have to focus just on reading. That's all we need to focus about. But there's more needs than just that. So if the student's having behavioral issues, possibly due to the dyslexia or something else, that box should be checked. Yes, the student needs behavioral supports. The student might need a behavior intervention plan as well. This should be discussed. Certainly assistive technology should be discussed. And what districts will often say, oh, there's been no assistive technology evaluation, so we can't recommend it. Yeah, well, why hasn't there been an assistive technology evaluation? And not only that, if the CSE is in agreement that the student needs assistive technology, we can check that the student needs it. We can check that the student needs it at home. And then an assistive technology evaluation can be conducted. Now, if assistive technology is recommended, the CSE might say, well, we only deal with school. But that's not what education's about. Education extends outside of the school day as well. And if the student needs this in the home environment as well, for example, to do homework or anything like that, assistive technology must be recommended in the home. And I've never met an assistive technology independent provider who has not felt like assistive technology needs to be done in the home as well as in school. Post-secondary goals are often not discussed at IEP meetings, and they need to be if the student's over 13 years old. Good, measurable, specific goals need to be developed for what's going to happen with the student once the student transitions outside of high school. These have to be updated as well. I see for 5 years worth of IEPs, the exact same post-secondary goals. Vocational assessment must be conducted to understand what those post-secondary goals are as well. If it hasn't been, you can include that in your IE request. But obviously, what the student does after high school is extremely important, and that has to be addressed at the CSE meeting as well. Then we get into our annual goals. Annual goals, first question is, when and where are these annual goals developed? Oftentimes, they're not discussed at the meeting and they somehow get put on an IEP. They must be discussed, and every one of these goals must be discussed at the IEP meeting. We need to have somebody at the IEP meeting who developed the goals and why they developed them that way, and how they develop them that way. Oftentimes these goals are developed beforehand without the parent there and without the parent having an opportunity to express any concern about a goal. The goals have to be measurable, they have to be specific, they have to be tailored to the individual's unique needs to allow for progress. So, for example, an annual goal that says student will increase his or her reading level. Now, that's not a good goal. We don't know how much the student needs to increase to meet that goal. That goal can be for anybody, so it's not tailored to the student. And it doesn't allow for progress. Let's say the student has a 10-word, is able to read 10 words. Student was able to read 11 words by the end of the year. That's not meaningful progress, but the student met his goal or her goal. So that would be an example of a poor goal. Now, I have an example of a very good goal that I saw in an evaluation from an independent provider, and you'll notice in this goal, it addresses the annual goal, and then it breaks it down into measurable and specific short-term objectives for the student to meet. So this is what a good goal should look like. So To improve receptive language skills, the student will develop the following skills. A, the student will respond to his name being called by turning his head toward the speaker when provided with moderate visual and auditory cues with 80% accuracy. B, the student will demonstrate imitative play with familiar peers when provided with moderate verbal and visual cues with 80% accuracy. C, the student will follow routine 1- and 2-step directives with 80% accuracy when provided with moderate verbal cues. And the evaluator goes on to have more short-term goals. Now, you have to remember that these goals are annual goals. So this is all the students getting for the whole year. So they have to include everything that the student's going to be doing in that year. Saying the student will improve by 5 vocabulary words over the course of the year is not enough. That's not gonna cut it for a student. One moment. Okay. Then we get into our recommendations section after the goals. The recommendations are extremely important, and this is where the independent evaluations can really be your bread and butter, because the CSE may not want to recommend certain things that the student will need to make progress. But you might have an evaluation right in front of you that says the student needs this in order to make progress, and the district might not have any data indicating anything to the contrary. So certainly with the neuropsychological evaluation, placement recommendations, this could all be extremely helpful here. Now the recommendations must match the present levels of performance. So in the present levels of performance, if for example the CSE indicates that the student needs one-to-one instruction, and then all of the students' related services are recommended in a group of 5. That's a problem. Why aren't they recommended in one-to-one instruction like the present levels of performance say? So there has to be a matching. It has to make sense. And again, all of this, all aspects of the recommendations must be discussed at the CSE meeting, and they must be tailored to allow for the student to make meaningful educational progress. So placement is important here. Placement recommendations on an IEP could include a general education classroom with special education teacher support services, which is really some group instruction by a special education teacher in addition to the general education environment. Could be an integrated co-teaching classroom, which has a general education teacher and a special education teacher in it, with general education students and special education students. Both those environments are usually about 25 to 30 students. After that, the recommendations could also be a 12-student classroom with 1 teacher, 12-student classroom with 1 teacher and a paraprofessional or 2 paraprofessionals. There's 8-student classroom recommendations, 6-student classroom recommendations. Really, the classroom recommendation needs to match the student's needs. And this is where neuropsychological evaluation for a student with dyslexia that recommends a 12-student classroom, something like that, could really be helpful. I would have a hard time being comfortable with a recommendation for a student with dyslexia to be in a large classroom environment. I believe a 12-student or less classroom environment for a student with dyslexia, where there's not a lot of distraction, where the student can receive a lot of individual attention, is appropriate. The larger classroom environments would concern me. For classroom environments, a district will often make a least restrictive environment argument to the parents, saying that, oh, we have to put the student in the least restrictive environment, and the least restrictive environment is integrated co-teaching classroom, and a 12-student environment would be too restrictive for this student. But if you have a evaluation, or even if you believe that the student cannot make progress in that integrated co-teaching classroom environment, and the student has not made progress in the large classroom environment, that recommendation needs to change. It's based on what the student needs to make meaningful progress, and it's very important to keep that in mind. Now, the related service recommendations are also very important. So speech and language supports, for example, occupational therapy supports, counseling supports, parent counseling and training, assistive technology supports, are all related services that can be important for a student with dyslexia, and anything else the student might need as a service to allow the student to progress. The district might recommend one speech and language session in a group of 5 one time a week. Now, where did they get that speech and language recommendation from? The recommendation needs to be discussed at the meeting. How did they come up with that? Why isn't it individual sessions as opposed to group session? Why isn't it more times a week for this student? The student needs speech and language services. And that should extend to all of the other related services as well. And certainly for a student with dyslexia, I'd want to see individualized reading supports and individual writing supports on that IEP as related services as well. I've seen evaluators recommend 5 days a week, 60 minutes a session of individualized reading support. That seems appropriate for a student with dyslexia. I'd want to see that on an IEP. You also have to think about the math supports as well. A CSE might say, oh, no, the student has reading problems, it doesn't involve math. But what about reading word problems, for example? So the dyslexia could extend to other areas as well. We have to keep that in mind. Methodologies is also something that CSE might tell a parent, oh, we just don't do methodologies. We can't do methodologies. We can't put that on the IEP. Methodology can absolutely be on an IEP if that's what's necessary for meaningful progress. Student with dyslexia likely will need some kind of evidence-based reading methodology, like the Wilson reading system, or like Orton-Gillingham. And if the student requires that, that needs to be on the student's IEP, and that needs to be what the student is mandated to receive. Now, the district is required to provide all the services recommended on the IEP. If the district's placement cannot provide that, the district has to explore out-of-district placements that can provide for all of those services. And when a parent receives the IEP should mimic what was discussed at the IEP meeting. If there's information on the IEP, for example, that was not discussed, or information that was discussed that's not on the IEP, or different recommendations, that's immensely problematic. And one other aspect of the IEP that should be discussed is also the need for a 12-month program. CSEs often don't discuss this, but if a student shows regression tendencies while during school breaks, a 12-month school year must be considered for that student.
Great, thank you, Andrew. So Rachel, Andrew mentioned that you would be provided with the IEP at some point after the meeting. Can you just describe what exactly the parents can expect to receive after the IEP meeting?
Sure. So the parents should receive a copy of the IEP after the meeting so that they can have that to refer to. And they should also receive something called prior written notice of recommendation that spells out all of the services that are being proposed for the child. Then, within 60 days of the parent signing the initial consent to evaluate the child, the parent should be given an authorization to attend, which is another consent form that basically says that the parent is agreeing to have those services provided to the child. And at that point, everything should start rolling.
Great, but Andrew, what happens if the parent disagrees with this IEP?
Okay, so if the parent disagrees with the IEP, the parent should consider pursuing litigation in this matter and seeking representation to help them with that litigation. Again, the parent can do it on their own, but I certainly wouldn't suggest it. I'd certainly suggest going to that COPA website or another website and finding educational representation to help with the hearing process. Now, one of the great things about the Individuals with Disabilities Education Act is there's a fee shifting provision which allows low-income families to garner the services of attorneys, and the attorneys can recover attorneys' fees as a prevailing party from the school district. And this allows attorneys to represent low-income families. For example, the law firm, the Cuddy Law Firm where I work, primarily works under the fee-shifting provision, and through that is able to represent families who otherwise could not afford legal representation. So parents shouldn't think that they cannot necessarily afford legal representation, but should certainly consider these options. So the first step in the hearing process would be the hearing request. Once the hearing request gets submitted, the hearing request includes usually some background information about the student, the legal claims that the parent is making, and the relief that the parent is seeking. Relief could be some type of compensatory education. It could involve placement for the student. It could involve what the CSE needs to do the next time they reconvene. And the parent is trying to show that the IEP that was developed did not allow the student to make meaningful educational progress. And the IEP was not reasonably calculated to do such. So once the hearing request is filed, a hearing officer is appointed to preside over the matter. And then the resolution period starts. The resolution period is a 30-day period in which the district can resolve the claims and the relief in the parent's hearing request. And the district has 15 days to meet with the parent, and then again the period is 30 days. Once the resolution period ends, we move into the hearing process. That's where evidence and testimony is presented to the hearing officer so that the hearing officer could make a determination regarding whether the district failed to provide the student with a free and appropriate public education, or FAPE, which again part of that is that the IEP was not reasonably calculated to allow for meaningful progress. After the hearing process is over, the hearing officer renders a decision, and in that decision, hopefully the hearing officer finds that the district denied the student a FAPE and grants the parent the appropriate requested relief.
Great. Is there anything else that anyone would like to add before we move on to questions? No?
Nothing from me.
Okay. Well, that concludes our presentation for today, but now we have time for a couple of questions.
Okay, so first question is from Davina Ramos. She says, my son is 11 and has autism and a writing disability. He had trouble learning how to read as a young child. He can read, but below grade level. Should I suspect dyslexia?
I'll take that. Again, this would be an important, and I have to be careful about giving legal advice here because I can't do that. But what I would recommend in any case where a parent thinks that a student might have a certain disability like dyslexia is to find a way to get appropriate evaluations to determine what's going on with that student. I really can't hammer in the point home enough about how important a good evaluation is to this whole process. It really feeds the whole process and really impacts the development of the IEP.
Actually leads nicely into the next question, which is from Lucy Santana. She says, I had a concern for dyslexia for my child, but the school stated They don't evaluate for that and denied services because her academic level was no concern. Any thoughts?
Okay. Well, again, in a scenario where a district would be asserting that they don't evaluate in a certain area, and that's a suspected area of need, I would always consider an independent educational evaluation, and to see what the district has to say about that. And again, the process laid out for that was discussed before. And then if, I'd always be concerned when a district says that we don't do that. And I'd also be concerned if a district says, well, the student's not showing any academic delays. What is the district basing that on? Academic delays can be in a number of areas. A student might be close to grade level in certain grades, for example, but there might be some severe deficits that the district is missing, and that the district is not addressing when they just say academic delays.
The next question, actually it's more a comment from Michelle Rojas. She says, "As my understanding of working inside a school, there are no services for dyslexia in New York City schools."
It's certainly possible that that at the school where Miss Rojas is, that services are not being provided or not being presented, or somebody conveyed that information to Miss Rojas, but that certainly is not the case. Not only that, the district, if a student has dyslexia and that's impacting the student's reading, writing, math, behaviors, whatever it is, all of the areas we talked about before, the district is obligated to make sure that those services are provided for the student, so that the student can make meaningful progress. If they're refusing to provide them or saying they're not providing them, that's not accurate.
The next question is from Diana Biagioli. Just curious as to why mediation was not mentioned as a possible recourse if a parent does not agree with the IEP.
Okay, mediation certainly is a recourse, and it's always something to consider. What I do is all litigation, and I find that litigation is able to lead to the most amount of change. But mediation is it's contemplated by the educational regulations. It's certainly an option to consider, especially for a parent who might not want to pursue litigation. It's a good option.
We have a follow-up question from Davina Ramos. "I did get a neuropsych eval for my son and diagnosed him with a writing disorder, but didn't rule out dyslexia. Is there a specific test that I should get for my son?"
Again, I would not want to. I'm not a neuropsychologist. I would not want to qualify myself as such. Usually, when you have a comprehensive neuropsychological evaluation, the neuropsychologist will look into that. So I can't really speak more about that, unfortunately.
But this could also be where you could ask for an individual evaluation, educational evaluation, if that was an evaluation that you've got from the school.
And it's also very likely that the evaluator who did the neuropsychological evaluation can help you to find out what kind of evaluation might be appropriate and who might be appropriate to help conduct an independent evaluation, if that's what you would like to do.
Okay, we have another question from E Private. Probably shouldn't have announced that. "My child's annual IEP meeting is coming up. How can I request assistive technology at home?"
I'm not 100% sure what that question means. If it's requested, if the requester is saying that at the IEP meeting to request assistive technology or apart from the meeting. But if you're at the meeting, I would suggest just like that to say, if you believe your child requires assistive technology, to voice that at the meeting and to be prepared to say why. So that would be and if that's the case, to try and make sure that appears on the student's IEP. Again, it's always if you can have some kind of independent assistive technology evaluation in your back pocket when you're going into that IEP meeting, you're going to have a lot more support for your request than if you don't.
Okay, our next question is, my son is 13 years old and in 8th grade. He is dyslexic. What can I do when his IEP has absolutely no specific or measurable goals?
Well, there are again options when you disagree with an IEP. One option we talked about before is that mediation option. Another option is having asking for a reconvene of the Committee of Special Education to develop a better IEP. The model that again that we like to follow at the Cuddy Law Firm, and I think is most effective, is the litigation model, where if the district develops a problematic IEP, and certainly an IEP without goals or without any goals that are specific to the student, is problematic, certainly consider bringing forth the hearing.
Okay, thank you. Veronica Rivera says, my daughter's CSE meeting is coming up, and I'm not satisfied with the school's evaluation and its validity. She's well below her grade level and didn't meet last year's IEP goals. I just got an appointment with a neuropsychologist for an assessment and may fall after the CSE meeting. How does that work? I won't have my daughter's results. Should I request litigation or request to delay the meeting?
Well, certainly the neuropsychological evaluation after the IEP meeting is not going to help that current IEP. You could always request another IEP meeting after the neuropsychological evaluation. It's also unclear whether this is an independent neuropsychological evaluation or how this is being conducted. But if it's independent of the district, you'd also want to consider filing that letter requesting independent evaluations in the areas of need. Okay, hopefully I answered that question.
That's all we have right now.
Okay.
All right, well, thank you, and that will be the official conclusion of our presentation today. Anything else anyone would like to add?
Nothing. Thank you for joining us,
Thank
everybody.
you.
I hope this
Thank
was
you.
helpful.
Thank you.
I'm just going to say one thing before we go. If you have any questions about anything you've seen today, please call INCLUDEnyc's free helpline at 212-677-4660. Thank you.
Thank you.
Thank
Thank you.